Director of Information, and you have a representative from the Edward Francis Small Hospital, the Chief Medical Director, Dr. Al-Jafari, and to my left, Chairman, the Chairman, the Medical,
Medicines
Control Agency, what's his name?
Dr. Sanya.
Dr. Sanya. I beg your pardon, I didn't know who these guys were. And then to my left, of course, is the chairperson of the Victims Association, Mr. Ibrahim Sanya, and we have Mr. Babukar Suare, or should I say His Excellency Babukar Aliu Suare, former Deputy Ambassador in China, and he was the chair of the Presidential Task Force. And of course, I have Mr. Honorable Distinguished Barrister Hussein Tomasi, the Solicitor General. Of course, a good brother over there, Mr. Gassama, from a representative of the World Health Organization. Of course, Babukar Sen, the Dean of Reuters in Western Central Africa and the owner and editor of The Point newspaper, on whose soldier a legion of journalists and followers. I have members of the press, victims' family representatives, and distinguished guests. Ladies and gentlemen, it is
members of the task force.
Babukar Suare and his team. Yes, they here. I cannot name them individually, but I know Mr. Jafune is there, and everybody, whether you are mentioned or not, you are recognized. Moments like these are not very happy moments. It offers us a profound sense of grief and sadness. We are all bereaved together as a Gambian family. It is reminiscent of the words of the English poet John Donne, Jacobean poet in the 17th century, who said that every man, no man was an island entire unto itself, that every man was part of the continent, a piece of the whole, that the death of any man diminishes me because I'm involved in mankind. Dr. Samate and the doctors that work with him are involved in mankind. So obviously, certainly, the death of one child, just one child, is a lot to them, particularly a whole host of children. And this was in the wake of the outbreak that happened here in the summer of 2022, when news broke on the BBC that several children in the Gambia have succumbed to death, to a disease that remains very, unknown, precariously. Subsequently, Dr. Samate, working with the president and experts across the globe, actually went on a program to make sure that they come to the bottom of it. As a consequence, I have before me 3 reports. The first report that came out of this episode is called the Causality Assessment Report on Acute Kidney Injury Outbreak in Children in the Gambia. This was published between June-October 2022. And this was done by the World Health Organization in partnership with the Gambia government. Subsequently, President Barrow's own government established a task force chaired by Babukar Suare that also submitted a report in March 2023. And I have a copy of that report. It's called Acute Kidney Injury Investigation Report. Then the final report is called the survey report by the World Health Organization. So the purpose of this literature, at the end of the day, journalists and concerned people will be given this report to go and read and study and come to realize the efforts actually at work in the production of these 3 documents. Apart from that, this is not a press conference. This is a news conference or a news briefing. It's a press briefing. The difference is, in a press conference, at the end of the day, journalists will pose questions and they're answered. In a press briefing, information is provided to journalists unless if they want clarity based on numbers, questions are not entertained. And in this particular instance, there's a reason. Precariously and obviously, the case of the acute kidney injury problem in the Gambia has attracted international attention. The Gambia government is embroiled in potentially 2 legal suits. The government of the Gambia is pursuing litigation against Meden Pharmaceutical in India. At home, the victims' families are also suing the Gambia government. So a press conference would provoke and elicit information that may potentially be injurious or prejudicial to the outcome of these cases. And as a consequence, there will be no questions. Dr. Samata will read out his statement talking about the whole corpus of literature that I have here. He'll unveil it, he'll provide you the report, and you can go and read and study the report. Unless, if you seek clarity, if there's a particular statement of his that you found ambiguous or unclear, then in that case we can entertain the question. And on that note, Dr. Samate, I invite you to come forward. Thank you.
Thank you very much, spokesperson. The Minister of Gender, Children and Social Welfare, the Minister of Information and Communication, the Secretary General of the Republic of the Gambia, the Chairman and members of the Presidential Task Force on AKI Inquiry, Chairman, Medicines Control Agency, the Solicitor General, the Government Spokesperson, the Chief Medical Director, 𝒂𝒄𝒄𝒏 Teaching Hospital, Chairman and members of the AKI Victims Association, the bereaved families, the representative of the WHO, the Permanent Secretary, Minister of Health, and other government officials here present, media personnel here present. I would like to take this opportunity to welcome you all to this gathering, whereby we would like to update the bereaved families and the whole nation on the acute kidney injury outbreak in the Gambia, and to provide the findings of the various investigations. I want to first and foremost extend the condolences of His Excellency, the President, Mr. Adama Barrow, and his entire government to the bereaved families whose children are no longer with us today. May Allah grant them Al-Jannatul Firdaus and give you the fortitude to bear the loss. Acute kidney injury is a sudden onset of deteriorating function of the kidneys, which manifests as oliguria, diminished urination, or anuria, that's absent urination, and other symptoms such as edema, confusion, nausea, vomiting, diarrhea, shortness of breath, coma, etc. This is because the kidneys are damaged and unable to maintain the internal milieu of the body, leading to accumulation of toxic products of metabolism, which becomes fatal in some cases. Acute kidney injury has many causes. Among these are Escherichia coli infection, severe dehydration, which might be as a result of diarrhea and vomiting, nephrotoxic drugs and substances, malaria, etc. Background on the outbreak. On the 26th of July 2022, the Ministry of Health was alerted on the increasing number of children presenting at the Edward Francis Small Teaching Hospital, and many of these children succumbing to their disease. The Epidemiology and Disease Control Unit of the Ministry was instructed to swing into action to get to the root of the problem. The World Health Organization, WHO, was contacted for support in handling the outbreak. An incident management system was set up to manage the situation. The incident management system, the incident management team, was co-chaired by the Minister of Health and the WHO. The membership comprised of an experienced team from the Ministry of Health and its various units and directorates, Medicines Control Agency, that's MCA, representatives of the partner institutions like WHO, UNICEF, Center for Disease Control, CDC in Atlanta, Georgia, doctors from the Edward Francis Small Teaching Hospital, etc. Extensive deliberations took place in the committee meetings, and the AKI response decisions came from this committee. Various WHO experts, including the Regional Emergency Director for Africa, the Incident Manager for Africa, came to the country and participated in the incident management deliberations. Since the phenomenon was unprecedented in this country, it was very difficult to ascertain at first what was causing the acute kidney injury, AKI. The committee suspected that the AKI could be caused by drug toxicity, since paracetamol toxicity was identified as a cause of AKI in some countries in the past. The World Health Organization country office helped to send patient samples and samples of drugs used by these patients to laboratories in Senegal, Ghana, France, and Switzerland. In the meantime, doctors noticed a convincing trend in the occurrence and worsening of the disease in some of the children on consuming certain drugs. The Ministry of Health decided to ban these drugs even before receiving the confirmation from the laboratory testing. This led to the press release instituting the ban on the consumption of paracetamol syrup in the country on the 7th September 2022. This was later followed by a ban on promethazine syrup on the 10th September 2022. The ministry imposed these bans despite criticisms and complaints from some people at that time that we were banning drugs without conclusive evidence. During this time, some patients continued to receive treatment at Edward Francis Small Teaching Hospital, while some families opted to travel to Senegal for further treatment. The government and partners put our efforts together to provide needed materials, including hemodialysis equipment for the children and other drugs and medical items. This involved an enormous commitment from the health workers in the hospital in providing care for the patients and in the field carrying out surveillance activities. The laboratory analysis confirmed that toxic levels of ethylene glycol, EG, and diethylene glycol, DEG, were found in 4 syrups, namely promethazine oral solution, BP, cofexmalin baby cough syrup, Macof baby cough syrup, and Maghrib cold syrup. DEG and EG are organic compounds that are found in certain products such as industrial solvents and antifreeze, and are used as raw materials in manufacturing polymers. Accidental or intentional ingestion of DEG and EG products has been known to cause poisoning. Illegal use of DEG to replace glycerin or propylene glycol as a solvent in medications has been reported in some countries in the past. All 4 of these products were manufactured by Maiden Pharmaceuticals in India and were imported to the Gambia by Atlantic Pharmaceuticals. Government immediately banned Atlantic Pharmaceuticals, who got their license withdrawn and their premises closed. This was followed by police investigation into their activities. The Medicines Control Agency sprang into action with a series of steps to remove the drugs from circulation. These steps included a ban on the sale and consumption of all Maiden pharmaceutical products in the Gambia. This was followed by a recall of these products from the drug outlets and households. The outbreak was controlled by November 2022 after the products were removed from circulation. We have never lost sight of the fact that sadly 70 children died as a result of the outbreak. The AKI outbreak was a national tragedy. This was a very difficult moment for all of us, and we wish to emphasize to the bereaved families, His Excellency's President Barrow's resolve and that of his government to addressing this issue. However, it was very important to establish the cause of the acute kidney injury in a scientific way. At the request of the Ministry of Health to the World Health Organization, WHO, a causality assessment committee, CAC, was set up comprising of both local and international experts. His Excellency, the President, also established a task force to inquire into the death of children as a result of consumption of contaminated medicines imported into the country from India that is suspected to cause acute kidney injury. The National Assembly also set up an inquiry into the AKI deaths, and their report was also presented to the Ministry of Health for action. The Ministry of Health, in collaboration with the WHO, conducted a thorough epidemiological investigation entitled Acute Kidney Injury Outbreak among Children in the Gambia from June to September 2022. an outbreak investigation report. This was submitted to the Ministry of Health and was intended to corroborate or refute findings of the causality assessment. The causality assessment. The causality assessment team worked closely with the Gambian Ministry of Health, MOH, the Medicines Control Agency, MCA, and the Epidemiology and Disease Control Unit to come up with the most plausible causal association that led to the AKI. In short, the CAC concluded that the outbreak of AKI in children in the Gambia was attributable to medicines contaminated with DEG and EG, DEG or EG. In addition to reviewing the laboratory evidence, the Causality Assessment Committee found that the clinical presentation in these children was highly consistent with DEG or EG poisoning in previous outbreaks. However, the cessation of the outbreak after the suspected pediatric syrups were withdrawn strongly suggested that poisoning rather than other causes was behind the AKI deaths. The conclusion of the CAC are consistent with the conclusion made by other bodies investigating the matter, including the WHO. The task force, presidential task force. After reviewing the findings of the causality assessment report and conducting a series of interviews and reviewing numerous documents, the presidential task force made a series of findings and recommendations, a few of which will be highlighted today, since we are going to launch the report shortly. First, the task force confirmed that the deaths can be conclusively linked to the 4 cough syrups imported by Atlantic Pharmaceuticals from Maiden Pharmaceuticals in India. The task force also investigated how these syrups were imported from India and distributed in the country. They learned that the affected medicines were not registered with the Medicines Control Agency, even though the regulation requires all medicines to be registered before importation. The MCA has the legal responsibility to ensure all medicines and related products are submitted through an application for registration prior to importation. The task force found that there is an urgent need for a quality control laboratory to conduct proper testing on all medicines and related products imported into the country. Although the statute authorized a national laboratory years ago, the MOH failed to establish the national laboratory. One of the fundamental requirements of registration is that an applicant must submit a copy of a certificate of a qualified pharmacist, and that failure to submit the requirement will render the application invalid. All licensed importers with the Medicines Control Agency are expected to have met the aforementioned requirements. The requirement of the law is that the licensed pharmacist will serve as the supervising pharmacist, working for or with the importers to provide professional advice to the importer during the process of importation and distribution of the medicines and related products. The task force indicated that 𝒂𝒄𝒏, serving as a supervising pharmacist for Atlantic Pharmaceuticals Company Limited, admitted to signing off the importation of the 4 cough and cold syrups, later found to be contaminated. According to the task force, Mr. 𝒂𝒏 only provided technical advice for the procurement and importation of the medicines, but did not do any background check on the manufacturer. Recommendations of the task force. The task force came up with some recommendations for implementation by government. Some of these recommendations are in progress and will be highlighted. We will highlight a few today. 1. The government of the Gambia should ensure that the MOH urgently facilitates the establishment of a fully operational medicines quality control laboratory as mandated by the Act. The response is that the World Bank is helping the government of the Gambia in establishing a food and drug quality laboratory in 𝒂𝒊𝒏. The architectural design and the development of the bill of quantities is currently going on, and the construction work will start soon thereafter. Government has already tasked MCA to get support from partners. This is already ongoing with support from the WHO and the Pakistani Drug Regulatory Authority. This step will continue and will be enhanced. The MCA should establish a fully functional pharmacovigilance department to include a medicine safety expert committee, regional hospital monitoring and investigation teams, and focal persons at the regional health directorates and health facilities as required by the regulation. The response is MCA has already started this process, and MCA is instructed to ensure the expansion of the scope to increase coverage and efficiency. 3. MCA should recruit students who have graduated from UTG in biochemistry, chemistry, and biological sciences to strengthen its human resource capacity. The response is MCA is being instructed to act on this. Number 4, the government of the Gambia should refer the matter of 𝒂𝒄𝒏𝒏, the supervising pharmacist for Atlantic Pharmacy, to the Pharmacy Council for appropriate disciplinary action. The response is that the matter of 𝒂𝒄𝒏𝒏 will be immediately referred to the Pharmacy Council for appropriate disciplinary action. Number 5, the government, through the Pharmacy Council, Ministry of Higher Education, Research, Science and Technology, and the University of the Gambia, should prioritize the establishment of a school of pharmacy at the University of the Gambia to meet the growing demand for pharmacists in the country. The response is this process has started, and advertisement for the recruitment of consultants for the curriculum development will soon be out. This initial phase is being funded by the World Bank. Preliminary discussions in this line have also been held with the World Health Organization Director General, which will be followed up urgently. Other possibilities with other partners and potential partners will be explored. Recommendation number 6, the government of the Gambia to permanently revoke the importation license issued to Atlantic Pharmacy Company Limited and their directors. The response is the license of Atlantic Pharmacy Company Limited has been permanently revoked. Number 7, the government of the Gambia through the MOH should review the laws and regulations surrounding granting importation license and instill stringent conditions so as to ensure that importers are approved based on their qualifications, operating with a sense of accountability and responsibility rather than being principally driven by profit. The response is the Ministry of Health has retained an experienced law firm that is currently carrying out a review of all health-related legislation in the Gambia. This will be carried out as part of our ongoing review of the acts under the Ministry of Health. Number 8, recommendation 8, the government of the Gambia should with immediate effect dismiss the executive director and deputy executive director and consider prosecuting them in line with the relevant laws for their abdication of their official duties. The response to that recommendation, considering the foregoing, for the purpose of strengthening the MCA and restoration of public confidence in the institution, the executive director of MCA has been dismissed with immediate effect, and also the contract of the deputy executive director is terminated with immediate effect. The report will also be forthwith transmitted to the Gambia Police for further action. Recommendation number 9, the government of the Gambia through the Ministry of Justice and Ministry of Foreign Affairs should forthwith explore the possibility of instituting further legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals, and should engage with the government of India to seek criminal and civil redress on behalf of families of the victims of the AKI outbreak. The response to that recommendation is the government is far advanced in exploring avenues for potential legal action against Atlantic Pharmaceuticals and Maiden Pharmaceuticals, as well as potential redress through engagement with the government of India. The government of the Gambia is currently benefiting from legal advice from a top-tier legal law firm that will support us in carrying out this. Following this press briefing, copies of the entire report will be released to the public. That is the Presidential Task Force Review report. And at this juncture, we hereby release the Presidential Task Force report for the public. Copies will be circulated to you by the government spokesperson. In addition, for better understanding of the concepts and the analysis of establishing a causal relationship between the contaminated medications and the development of acute kidney injury, we will equally release the causality assessment report carried out by the World Health Organization in collaboration with the Ministry of Health. To further analyze the causal relationship, to dig into the issue by going back into the communities where the children hailed from, it was important to also carry out an epidemiological review in a case control study format to correspond each case of AKI to a control in the community. The Ministry of Health asked the WHO to support in conducting a survey, which survey is intended to either corroborate the findings of the causality committee and then or to refute the findings of the causality committee. And this is the survey called Acute Kidney Injury Outbreak Among Children in the Gambia, June to September 2020, an outbreak investigation. And this will also be released to the public for proper review. And this has also corroborated the findings of the causality committee, which was also taken into consideration by the Presidential Task Force in coming up with their findings and recommendations. We want all to note that the government of President Adama Barrow will continue to engage the international community, our community, local community at large, the bereaved families, the Victims Association, to continue working together to deal with the acute kidney injury outbreak. We wish to thank the Presidential Task Force, the chairman, and all the membership for the hard work, dedication, commitment, and all the sacrifice to ensure that this report, this investigation is carried out and this report is put together, advising government on the next steps with regards to acute kidney injury. We thank you very much. We equally want to thank our partners WHO, who has been there with us from the beginning, and all the international experts WHO brought in to the Gambia to support the process. It has been very tedious because this is unprecedented in many cases, in many nations. However, reports were there, but WHO's expertise and their international pool of experts came to our aid at a very, very difficult period in the history of our country. All these collective efforts, with the help of the Almighty Allah, made it possible for us to contain the outbreak. In addition to WHO, there have been other partners, the UN body, UNICEF, and other partners from America, the Africa CDC, Atlanta, Georgia. We had experts from all of them who were with us here in the Gambia, being part of the incident management team, giving us, sharing ideas with us, doing research, giving us the input to be able to deal with this very, very difficult outbreak in the country. To the bereaved families, Mr. Sanyang and the Association of AKI Victims, we extend again our sincere condolences for this great loss to the nation. It has been a difficult, extremely difficult period, losing a loved one, a child that would be playing with you in the evening, expecting you to get home. That child that is growing and always smiling, losing that one, we all know the pain. We all know the difficulty. We all know the sadness. Words are not enough in expressing that sadness. But we want to extend our most sincere condolences from the bottom of our hearts. We want to express these sentiments from His Excellency the President, who is very, very touched by the whole AKI outbreak, being the most difficult period for him. And we extend his condolences to you. And we pray that Allah gives the children 𝒂𝒄𝒄𝒏 and all of you the fortitude to bear the loss. And as a country, we will all forge ahead, we work together to ensure that this never happens in the Gambia. I thank you for your kind attention.
Thank you. Thank you. Thank you so much, Dr. 𝒂𝒏, for that very touching, very emotional rendition of the developments culminating to today's event. Members of the press, we endeavor to supply you with adequate copies, as most of you are in the print media. Soft copies are sometimes better. You can copy and paste and do whatever you want to do with it. So Dr. Bitey, after this program, would get your contact details so he can just shoot you those emails. And then for the hard copies, we'll also endeavor to give you some. So I thank you for coming and for your attendance.
Can I seek a clarification?
Now, if you have any clarification question based on the information provided, Not that it's going to lead us somewhere, but a specific clarification question about the timing, the numbers, and stuff like that. Nothing technical that can draw us into some legal momo jumbo. You're welcome.
Thank you very much, sir, for allowing this clarification. You did say at the beginning that the government has filed a lawsuit, but it seemed that the Honorable Minister has said that they are in the process of consulting. So if at all there has been a lawsuit that has been filed, we would like to know, because, for example, we've seen the other lawsuit, which you did make reference to. So, and the numbers, how many children actually have died from AKI, because there are conflicting numbers. So just those two, clarification on the lawsuit issue.
Yes. I began by saying that because of the circumstances, very peculiar circumstances surrounding this case, we opted for a news briefing instead of a press conference. That I also said the government of the Gambia is saddled with two law cases. One, the victims' families are suing the government. Two, the Gambia government potentially is looking for, a way of also seeking redress in an international litigation. That's what I said. And then about the death of the children, I think Dr. Samate said 70 based on the report.
Yes.
Yeah, but you can explain.
Thank you very much. Just as the spokesperson said, the government is working with a top-tier legal firm based in the US, putting things together for potential lawsuit. But we don't want to go into that, I'm sure you understand. Now, as you can see in the report, the AKI outbreak, the total number of deaths was 70. Now, of course, AKI is a clinical phenomenon that was present before the outbreak. It was present before we were born. AKI is called acute kidney injury. It is injury to the kidneys with various causes. Now, subsequently, after the containment of the outbreak, we subsequently had two more cases. Probably that's what you are talking about, after the end of the outbreak. And those two cases would have been sporadic cases, not being part of the outbreak. So this is how, and certainly the report, we are narrating the findings of the report. And this report, we are not adding anything, we are not removing anything, we just summarize some of it. And fortunately, you are going to have the hard copies and both the soft copies, so you get all the information. Thank you.
We have information that 3 children died in 2023 from AKI, from those same medicines. And which raises the question that some of these medicines are still in circulation.
That I wouldn't advise Dr. Samate to answer. I don't think the Solicitor General would advise Dr. Samate to answer that question. At the end of the day,
numbers, like you said, sir.
No, it's about numbers, but it's about your government, your country, also being exposed to severe litigation. Yes. So, are you a citizen or a journalist?
I'm a journalist. I'm a citizen.
Yes, exactly. So your citizenship supersedes your journalism. Yes.
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 I want to ask